With schools reopening this week, parents and young people will no doubt be delighted to be back. We all want to see an end to the pandemic and the mental and physical toll that it's taken, particularly on children and young people. But what is the real situation with safety in schools? Because it seems to me that a political decision may be being taken to allow the mass infection of children with COVID-19 in Ireland. Because when you look at all of the factors and the lack of mitigation measures, that is a conclusion that you would come to. To listen to the government, you wouldn't think that we had the highest number of COVID cases in the EU and the second highest behind the UK. That was during the summer when schools were off. Now we'll have 3,000 primary and about 1,000 secondary schools reopening with thousands of staff. Some of those schools in Dublin West, in Greater Blanchardstown, have 1,000 students. At the same time, NPHET will be disbanded, the only oversight that there has been on the government. The message from the establishment is a switch away from public health towards personal responsibility. We all know what happened with Golfgate and Saponegate when establishment TDs used their personal responsibility. And children and teenagers can't use very much personal responsibility inside schools. Ministers have been gaslighting anyone who's questioned this strategy. They're making out that there'll always be people who are nervous. What is the real situation in schools? Yes, a big change and a positive change is teachers and SNAs will mostly have had the opportunity to be vaccinated, but students have not. In secondary, a proportion of students will have had one vaccine shot. Primary children have none and don't wear masks. Delta is twice as transmissible as the original COVID virus. And transmission is estimated to be only reduced by 50 to 60% with the vaccines. The government has given a very wrong and dangerous impression that the virus isn't that serious for children and young people. They've misused figures. Long COVID is a serious issue for children. At least 4,000 currently have it in the south of Ireland. It can take months, even a year, off a child's life, having huge costs as well, of course, for parents and families, giving up work, childcare, etc. 1 in 100 children who get sick with COVID get hospitalised. That's the figure in America, in the UK and in Ireland. The government have given a very wrong impression of 1 in 100,000. We have to reject the mass infection of young people as a government strategy. The government COVID plan for schools is the same as last year with air monitors, but portable ones and not for every room. And the recommended risk level is nearly twice that of the UK. Education unions and parents and young people have to come together to unite, to demand government investment so that we've high quality masks supplied for all students and teachers. FFP2 and properly fitting ones should be supplied by the Department of Education. This was something that was demanded by the ASTI last year. Now we need them to protect the students in particular. And this should include primary children over 5 who wear masks in other countries, and it will benefit and save them who they don't have the benefit of the vaccine. Clean air is more important than clean hands, but yet the government message has all been about, which is important, hand hygiene. We need clean air, we need ventilation and HEPA filtration. They've had 1.5 years to supply these to schools. Every classroom should have a CO2 monitor. We need more space. We need transparency in cases and isolation of people. Once said there is a danger of an infection. We need regular testing, and we need to vaccinate children under 12 when that vaccine is approved. The costs of these measures is estimated to be €10 per child. Does the government place enough value on the lives of young people to make this investment?